Hello and welcome to the Patient Educators Update. I'm Chuck Jones with Synergy Broadcast, and as always, I'm joined by our resident expert, Fran London. Hi, Fran.
Hi, Chuck.
For those of you who may not be familiar, Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she is also the author of the book, hold this up right here, No Time to Teach, the essence of patient and family education for healthcare providers. So our topics are always about patient education in a clinical environment. And today we're going to talk about how to teach a group. Most of our topics have been about how to teach patients individually, but one of the chapters in the book, Fran, on page 123 is called that you wrote How to Teach a Group. And I'm going to open by reading the very first sentence in this particular chapter. And it says, many think you can save teaching time by teaching patients with the same diagnosis or treatment in a group rather than individually. And then that would allow you to teach all of them just once instead of doing it one at a time. And you say that's what?
Not necessarily true. Yeah, because so much of teaching is individual assessment and evaluation of understanding. You can't really do that in a group more efficiently. On the other hand, group teaching does give another dynamic because adults do learn better from other adults. And they do learn better when they get to ask their questions and talk about their priorities. And a group is very good for that.
Yeah, and you get the group interaction as they talk to one another that you would not get in a normal one-on-one with the professional versus the patient. Now, one of the important, I guess, differences you talk about in teaching to a group, you say the instructor decides what the learners need to do to learn, and that this shifts the focus from the instructor to the adult learner. Now, I would tell you that most people who teach in front of a group, they decide in their preparation what they want the attendees to learn. And you're saying that's wrong.
Well, I'm saying it's not so efficient, and it's not the best way to use your time. Because if there's certain content that you want them to walk out with, you might as well just put it in a handout and give it to them. Yeah. I mean, why spend time doing it? Whereas the point of the group interaction is to really get them to get involved in the topic, ask questions, feel comfortable talking about things that they ordinarily wouldn't talk about. So it gives you a whole nother level of understanding, which is a good use of your time.
Yeah, and I think one of the things that will happen in a group dynamic like that is there is learning by doing. Even though they're talking about it, because of the personal nature of what they're talking about, and they all have real life experiences in that, that they can relate to one another, and the information sinks in a lot deeper than if you just tell them. Hence the comment, well, if you're just going to do this, just give them a sheet of paper and let them go, because it has the same impact.
Exactly.
Whereas this is much different. Now, another thing that you talk about that I think is really important here is that if you want the learners to remember and use the information, which has got to be the end goal, teach half as much content in twice the time. And why do you say that?
It gives them more time to reflect on the content. Adult learners also learn by thinking about what it is you said, how it applies to their lives, how it might fit in, how they might do it. And that takes time. So when you have a conversation in the group between either, attendees or the instructor and attendees, you still have time in that conversation where they can start thinking about things and then ask questions and process it. So you really get a deeper learning.
Okay. And that makes sense to me because with so many different people in the group, there are opportunities for you to go in a lot of different directions that relate to them because they're going to bring those up. Now, I guess there are two things I want to explore. Number one is, what types of groups are we talking about? Are we talking about a post-discharge group that perhaps has a chronic illness that needs to be paying attention to their ongoing maintenance and things of that nature? Or are we talking about a group that's still in the hospital that maybe just had, I don't know, bypass or something that, they may not have to have ongoing maintenance, but they do need to learn some things before they go home? So is it one or the other or both?
This works for both of those. Basically, you want an audience with the same issue, diagnosis or pre-op or something, so that they have something in common to be discussing. And you want them to be at the same phase, if possible, of the the chronicness, whether it's right before they go home or just diagnosed, or because it really does help with the content.
Yeah, and that brings up an important point, because one of the principles behind No Time to Teach is you need to assess the patient's situation to understand where they are before you can begin to teach them. So you just, if you start at the beginning and they're 3 chapters ahead of you, so does it make some sense to screen the patients a little ahead of time in the group to have them as close together as possible, or is that even something that you can or cannot influence?
Well, a little bit of range is good, because then the slightly more experienced patients can give advice to the less experienced. So that a little bit of range is okay. It's really, no, I don't think there's so much screening involved as self-screening. If they're not interested, they won't show up, and if they're not ready, they won't be there. I think you just have to trust the system.
Okay.
Trust that it's going to work.
Yeah. Okay. All right. Now, you also mentioned in that chapter that it takes a certain skill set. It's different in teaching with a group. And what I wanted to do is talk about a couple of these. You source some research done by Vella, V-E-L-L-A, in 2002. And some of the things that you talk about, number one, find out what the members of the group want and need to learn. And how do you do that?
Sometimes you can do that before the group starts, like do a little survey, like you've been invited to this group. What is it you want to walk out with? What is it you want to leave with? Often with a new diagnosis or a pre-op thing, there are common issues that people care about. So that will help lead how you present stuff. Certainly all the information you want to present, have in a handout. And it shouldn't be one of those PowerPoint little box handouts because you can't read the little words. It should be a real, like a pamphlet or a booklet talking about, if you're preparing a batch of people for knee replacement surgery. It should be all the information they need to know about that in the handout, and then the group meeting is a conversation about what they care about.
Okay, yeah, I echo your point about getting the little PowerPoint slides. I always hate that. Give me the notes for the PowerPoint slides maybe, but not the little slides themselves. That doesn't help me a bit. One of the other key items you talk about is move from small to big, slow to fast, easy to hard, and then connect the content to real life. Why is this important in a group?
You want to make it easy. You want to make it easy for them to jump in. You want to make them comfortable. One of the ways to do that is if you present a question, you ask the audience to look at the person next to them and discuss their answers to that question, which shouldn't be too personal, with just one other person. So that gets them relaxed. It's safe. It's just one person. They don't have to say any more than they're comfortable with. Then once they get talking, you can open it up to the broader group, and people are more willing and able to have a conversation within the big group.
Okay. Another point is give the learners control and offer learners choices. That sounds like you're being more of a facilitator than an educator, why do you want to give them control?
And that is what this is. This is more facilitation, because the information is going to be what they want to know. If you give them the issues that they're asking about, that will involve them and engage them, and they'll come out feeling like they got something out of the meeting. You don't want them to feel like they wasted their time. They knew it all already. It didn't mean anything. Mm-hmm. Often people in these situations hear things from friends or other people they know who have experienced whatever they're about to experience, and they have issues. They have questions. They've heard about infections, or they've heard about side effects, or whatever it is. You want them to be comfortable asking about those things.
Yeah, and one of your points is engage them in the process. Teach what is useful to the learner right now. And why don't you give us some reasons why you want to do that?
Again, for relevance. Mm-hmm. Adults learn best when they're motivated. So if they have a question right now, that if you ignore that, they'll have trouble hearing anything else you say. So talk about the issues they care about right now, address those, make them feel comfortable. If you can't give them the answers right there, at least offer to give them the resources after the fact so that their questions will be answered and they will have closure. Because that's the whole point of teaching.
Sure, yeah. And then one of the final ones is include an element of accountability. How do you do that when it's likely that you may not see this group again?
Well, one thing that works is at the end, have kind of a summary thing. What is it that you heard today that you might take home and do? Because just by the process of saying that in the group, and some people may not have anything that they took out, but often they come up with something that they will do, and that helps make them more accountable. So if it's taking their medicine after they leave, or whatever it is, it will help change behaviors.
Okay, that makes a lot of sense. Okay, well, that's about all the time we have for today. We will make this a two-parter, and we'll continue in the second part of this, and we'll talk about some discussion tips to help you design group activities and things of that nature. So we'll go ahead and close this element of the show right now. And I want to thank you for your time. Why don't you tell folks where they can find you?
I have a blog at www.notimetoteach.com, and I'm on Twitter at NoTimeToTeach.
Okay, cool. And for folks out there that may be interested in teaching a group about No Time to Teach, your book is available for a group purchase through your publisher Pritchett and Hull. That's p-h.com, and they get a sizable discount when they do a group purchase. So I would encourage folks to go look at the bulk purchase. It's a great savings, and the book is a great reference. And for those that may be interested in adding video and video on demand into their patient education toolkit, you can find out more at our website, synergybroadcast.com, or you can go to Google and Google MMDS or Medical Media Delivery System and find out information about our video on demand system. So, Fran, thanks very much for your time, and I'll talk to you next week.
Bye, Chuck.
Bye now.